Bismillahirrahmanirrahim. I welcome you all in this lecture. Today we are going to discuss about the prognosis, because the first foremost thing about prognosis is why we need this. So why is the quantitative estimation of a disease course is required actually? Because we want, apart from qualitative assessment of just saying yes and no, we also want to assess whether the disease in question has some severity or it is going to subside with the passage of time. And what is about the patient, from a patient perspective, they are always concerned about the prognosis of a disease. Third important parameter what we need to discuss is about the baseline of a natural history, so that the treatment alternates or improvement plans can be designed accordingly. Okay, so today we are going to discuss more about the prognosis aspect. So in order to understand prognosis, what we need to infer from prognosis, the first foremost thing is to quantify prognosis, and the estimation is done by a time point, that what time point actually the disease course is being followed for. For example, generally it is assumed that there are multiple phases of a disease course, but let's say this is a disease of an individual, and I am focusing over here. So there is an actual disease onset which is happening at cellular level. Now this time point and the pathological evidence and the signs and symptoms initiation, all the things which are happening inside the body before the evidence of any sign and symptoms, are categorized as preclinical forms, preclinical stage or preclinical formation. And from sign and symptoms till the medical advice, diagnosis and the treatment, leading to an ultimate fate of death or disease free atmosphere, this all falls under a clinical outcome or a clinical treatment plan. So these are the clinical durations, and from sign and symptom, which is the borderline, we are expressed. So prognosis is basically is expressed in terms of death or survival from a disease. Now, from where we calculate survival of an individual or death. Now this is a very tricky question. Usually, for a survival estimation, the time of diagnosis is termed as how long after the diagnosis of that disease the patient is able to survive, whether it is 1 year, 2 years, 4 years, 5 or 10 years. It is generally consensus upon that the time of diagnosis is usually referred in terms of prognosis, survival. But there are two parameters which are also taken in account, that some of the diseases are gradually, what you can say, start. For example, in case of arthritis, there is just one or two joints problem which are initiated, and then the disease involve all the joints involved in the human body. So these are called as indolent diseases. Or how the diagnosis is made, I mean, the patient may have gone through rigorous evaluations, or may have suffered extensively because of the wrong diagnosis. So the time of diagnosis is dependent on these three parameters which are important. Okay, so apart from this, uh, now the first and foremost parameter for the expression of prognosis is largely dependent on case fatality rate, which is generally written as CFR, case fatality rate. Now, case fatality rate means that the number of deaths by a disease divided by the number of cases which are being diagnosed. So, it always involves the diagnosed number of cases in the denominator section. So, it is different from what we infer from mortality rate, where we talk about the number of deaths by a disease divided by the number of individuals at risk. So, whenever we are talking about mortality rate, it is generally also written as crude mortality rate, but it is different from case fatality rate, where we're just specifically addressing the number of deaths by a disease divided by the number of cases diagnosed. So let's say, for example, if we talk about COVID-19, the fatality rate for COVID-19 earlier in China last year in 2020 Feb was exceeding more than 20% in won for the case fatality rate. So this is the case fatality rate, and it was exceeding more than 20% in China. But rest of the China, it has been declined to less than, now it says that according to some estimates it says that 0.5% case fatality rate has been reported. So the number of deaths by the disease has largely been reduced. Similarly, the number of cases diagnosed are gradually being influenced as well. So that's how this value is getting to reduced gradually. But in case of mortality, we have to see the number of deaths by a disease divided by the number of individuals at risk. That means all the individuals who are at the risk. But interestingly, the first foremost question what the patient wants to know about the prognosis is about his status, that is the infection fatality rate. I mean, how many number of deaths would happen? Am I going to die? The question is pretty straightforward, but the answer is not, because the number of deaths by the disease divided by the total number of cases in that disease is the trick. Now, this is different from what we can say about the case fatality rate. Over here, we are largely dependent on the tested cases. But over here, we are saying the total number of cases of a disease. Now, these cases may be in different time durations, as we have seen earlier. In some of them are maybe in preclinical form, some of them may be in treatment phase, and some of them may have gone for what you can say have a grave prognosis. So the number of deaths by the disease divided by the total number of cases in a disease is something of interest for, that is called infection fatality rate. But we are largely talking about the crude fatality rate, case fatality rate about it. Now CFR is not constant as it changes with time and location. I have given you the example of China. In February, the incidence of case fatality rate in China was more than 20% in Wuhan, while now it has gradually been reduced to 0.5%. Right now, across the globe, the lowest incidence is reported in Germany with 0.2%, and while the rest of the in Italy, the incidence case fatality is very much high, is about 7.7%. In India, Pakistan, and Iran, the case fatality rates usually fall around, if I uh, if I'm correct, according to the recent data, the case fatality rates usually fall around 2%. But look at the number, the 2% is constant, which is in Iran. The number of deaths reported are roughly around 60,000 deaths have been occurred because of this disease in Iran. In India, the deaths so far happened are around 1.7 million deaths have been reported, and for Pakistan, the deaths toll has, let's say, approximately 16,000 individuals have lost their life in Pakistan because of this disease. But irrespective of the number of deaths, the denominator values are deciding that the case fatality rate of this disease in Pakistan is 2%. It is following in across the similar lines. Right now, the death rate is around 1 or 2, which is exceeding gradually according to the graphical report, and this is highest in toll in terms of the disease prevalence in country. Now, the second alternate apart from prognosis is the person's year based estimation of survival. Now, the person year based estimation of a survival can be set as like if we follow a disease, that how many years the individual is at risk of dying of a disease. Now, if we draw like this table, and over here in this graph, we say that these are the number of individuals which are presented over here. Now, let's say these two individuals are followed for a duration of 1, 2, 3, 4, and 5 years of duration. So, their cumulation person year would be 10 persons per year. Apart from that, if we are not interested in these two individuals to follow them for 5 years, and we induct just how many individuals? We just induct these individuals. They're like, say, 5 individuals. We induct 1, 2, 3, 4, and 5. So and we follow them for, let's say, 2 years of time. So this is one individual person, so the total person here is 20. Over here for the two persons, this is individual 1, this is the individual, let's say, let's differentiate them with individual 1 and individual B. But apart from that, as an alternate, we can also study 5 individuals, and I'm labeling them with different color, let's say red color over here. So this is A, B, C, D, E. So these individuals are followed for a duration of 2 years, and in this way, the total cumulative year of the person's year would also be equivalent to what we have reported earlier. So, sorry, I'm just making a little bit space over here. The total person years would be 10 persons year, because 5 years of A and 5 years of B cumulative value would be 10 persons year. And over here, if we exceed this value from 0 to 2, the total person years time spent would also be the same one. Like for example, these are the 5 individuals and they are followed for 2 years of time. So the total person year is equal to 10 persons per year. So this is just another alternate way of presenting a prognosis. But sometimes the disease may not happen in the first 2 years, and the disease risk of dying because of that disease may be higher among the individuals for who are may be higher among those individuals at a later time point. Okay, so for example, the number of individuals who die in later ages are higher, when the greater risk of death is over here, greater risk of death. So the risk of dying of a disease is high over here. Number of individuals 5, 4, 3, 2, and 1, and this is the zero time point. And I am saying that sometimes the disease may remain dormant, or may remain, the death risk is low in the early phase. So we have to keep this in account in terms of person's year observation. So this is just for the sake of information that two persons to be followed for 5 years, or 5 persons to be followed for 2 years, giving you the same person year value. But it also depends upon the nature of disease, that the period of greatest risk of dying from that disease may fall in the later years. Okay, and the most interesting aspect is we can count the 5 year survival time point and use to assess the treatment for cancer. This 5 year survival time is also used for. Now, it is also used as the percentage of patients who are alive after 5 years of diagnosis or treatment. So, let's say an individual has been let's say there are two individuals over here. Let me draw a straight line and say that there is a lady who is suffering from breast cancer, and the infection was latent in 2000. There was no disease apparently, but in 2008 she faced a lump and she go for surgery. All right, so she operated that tumor out of her body, but unfortunately she died in year 2010. So the overall disease-free survival for this lady was just 2 years. So we will say that this is a failure in terms of survival of an individual for just 2 years. Okay, well, what will happen if she was residing in an area where there is an active complaint of early screening or monitoring of breast cancer screening or awareness programs are in continuation. So again, the disease began in 2000, but she, irrespective of any signs, she felt a lump and she treated that lump in year 2005, and this treatment led to her increased survival of 5 years. So, because of an early screening program and early prognosis of that disease, that is a success story. So, the survival time duration over here, the important point to make is that the survival time duration is not increasing the life expectancy of an individual, but it is somewhat addressing the quality of that life and to mend things at an early phase in their life duration. The same lady who is dying in 2010 operated a surgery in 2008 has just 2 years of survival, while in 2005 she has a 5 year survival, and that's the success of 5 years survival duration. This is just another alternate way of defining a prognosis. The lastly is the observed survival. So let's assume a hypothetical data of patients treated with 2000 to 2004 and followed for till 2005. Now let's say that there is no loss of data in a follow-up, and we have all the contact details of all the individuals, and the individuals remain in contact with us. Now the number of observation is that the patients enrolled in 2000 were 84, and they survived in 44 survived in the first term. Then for 2 years, 31 individuals survived. Then third in 2003, 4 in 2005. Now, if we rearrange the table based on first year, second year, third year, fourth year, and fifth years, the table rearrangement is slightly somewhat like this. Like in 2000, there are 84 individuals. In the first year, survival is 44. Now, the individuals who survived in the first year, irrespective of their enrollment, either in 2001 they are enrolled, but the year of duration is the same. So there are 31 individuals who survived for 1 year duration. They were enrolled over here in some time point in 2000. So 31 individuals from 62 survived for 1 year. Then from 93 individuals who were enrolled in 2002, 50 individuals survived for 1 year. Then in 2003, 60 individuals are enrolled, and we have collected 29 individuals. For first year, they remain disease free, and similarly, the data goes on and on. So we rearrange the table, and the table setting is as such. Now, in order to calculate the probability of surviving for first year, P is 1 is equal to 197 divided by 375, gives us a probability value for first year surviving, probability value for second year, and for probability value second year calculation, what we do, we calculate the second year probability variation over here, and I'm just zooming it out so that you can get a good understanding. For example, over here, the number of individuals who and the number of individuals survive, or the number of individuals who survive this duration at the treatment, 71 divided by 197. These are the number of individuals who survived in 197 minus 43, because these individuals are unable to survive for the second year. Okay, so we are subtracting it, 197 minus 43. This is the denominator which you need to learn, else is all fine for the probability estimation for first year, second, third, fourth, and fifth year, and the things goes on and on. So we draw a life expectancy over here, that 8.8% individuals who are treated in year 2000 have a follow-up period, are able to survive with this treatment plan, and this is how we calculate the probability of patients surviving for 5 years. So in order to, let's say if I am interested to draw the chart for this table, so what I'm going to do, I am going to draw two axes, number one x-axis and the number two is the y-axis. Let's say for y-axis, I say that this is the percent, let's remove this thing. So for y-axis, I will say that it indicates the percentage of survival, survival percentage. Okay, so this is the percentage survival, this is the zero value, this is one time point, 1, 2, 3, 4, and 5. So for the percentage survival values for the individuals who survived, and this is, let's say this is 100% values for a survival plot. So I say from 100 years of life expectancy that all the individuals have survived. The time point, let's say over here, is the 50% value. So based on my probability value, which is mentioned over here, 52%, I assume the first time point would be over here. Now for the second year, the probability says 46%. So I assume the value would be somewhat in the second year. The number of individuals who survived is somewhat around here, and assume this is the percentage survival. And then for this value of 0.65%, 65, this value of 0.6% value is also being drawn according to the scales, and I assume that the percentage surviving value should be increasing and decreasing accordingly. So I followed these terms and then draw it according to the prescribed view. Then this value of probability is defined over here and here, and this chart is going to present us some values, and then I'm going to draw it. But in order to ace it, there are certain formulas and there are certain softwares which are present, but generally we make a curve and pointing like things for survival analysis. I'm going to discuss the Kaplan-Meier survival in my next lecture. Stay tuned for it. But over here what you are looking is the probability estimation for one single time point values. Okay. Hope you like this video. If you have any questions, please feel free to ask.